Well, good morning. Good morning, Jessica. I'm very excited to have you with me today. You are the owner of Viva Stretch here in Jacksonville, Florida, correct?
That's correct.
Awesome. And I ran into you a while back when I came in for a stretch myself. I've got at least one tight hip, and I really enjoyed our session. And so I know that I do stretching quite a bit with my clients, and it's a staple of some people's health. And I know that you do things a little bit uniquely and have a little bit of an advantage compared to other people in the area. So I wanted to spread the word about what you do because I know people could really benefit from your services. So tell me a little bit about Viva Stretch and yourself.
Yes, absolutely. Well, thank you for the introduction, Michael, and thanks for
Yeah.
having me on your YouTube channel.
Yeah.
Definitely excited to be able to, have this opportunity to talk to everybody about what we do here at Viva Stretch and why stretching is so important.
Yes.
So basically our main goal is to offer assisted stretching. So it's an active
Mhm.
stretch where you lay on the table. We do all the work. The idea is that the stretch is comfortable and relaxing. A lot of our members and clients, they really refer to it a lot as the feelings of a massage, but you
Okay.
actually get long-lasting changes to the tissue,
Hmm.
right? So increased flexibility, circulation, all the things that come along with stretching. So the idea is that the stretch is comfortable, not painful at all. I think people get the idea that stretching must be
Hmm.
painful and they don't want to do it. So really our objective of what we do is to get people into a routine of stretching, notice the benefits of the stretching, and really become independent on their own and know how to stretch properly.
Awesome. Awesome. Well, I don't want you to overlook the fact too of your credentials and tell me what makes you able to do this better than other people.
So I am a physical therapist. So
Oh.
I bring that background. I have a doctorate in physical therapy,
Mhm.
which has given me the knowledge to differential diagnose. So when a client is in our studio, um,
Mhm.
I am able to, kind of look at different things that are going on. We're able to adjust their stretching appropriately depending on
Mhm.
what their conditions are and what might be going on. And, I also can look at them and tell them, if stretching isn't appropriate, is there something else that's important for them that they need to
Mhm.
incorporate into their program? So all of those things I think really pull together. We're able to do a one-on-one full
Yeah.
body 25-minute stretch, which is not something that's offered really anywhere else.
Yeah.
So we can do that, but we're able to manipulate and
Mhm.
do different things for clients that maybe somebody else isn't able to do, just based on our knowledge of
Yes.
the body and different
Yes.
conditions that people bring with them.
Yeah, I think you're exactly right. I think there's a couple things to take away there. I think, some people have a fear of stretching and they think it's going to hurt them. And I have that conversation all the time, and they don't really know how far, how much to push, and who
Exactly.
better on the other end of their body to have than a doctor of physical therapy, knowing what the end feel is supposed to feel like. So we look for those barriers, and if there are normal barriers or abnormal barriers. And I think that's really what sets you apart from other people in the area. When I'm talking with clients and I know that assisted stretching would be great for them, it's hard for me to be on the side of other organizations that don't necessarily have that background. And I know as a physical therapist, like you truly care about your patients and you would never do any harm to them and you would have their best interests in mind. And just showing them that, that stretching is important, but there's a way that we could do it to still have lasting benefits or a therapeutic benefit
Mhm.
that sets you apart from other people. So I appreciate you sharing that and some of those frustrations that we can have when we are trying to tell clients that they should stretch and they just have so much cloudiness around what that stretching should look like and feel like and is it appropriate for them. And I know you will attest to this too, but it's appropriate for everybody from back pain to hip replacements to knee replacements, like to the weekend warrior. That assisted stretching can help really elevate their care and their health.
Yes. Just like in the physical therapy clinic, right? When somebody
Yes.
is like, "Oh, I don't know if I should come in today, I'm
Yeah.
hurting." It's like, "Well, this is the best time for you to come in, right? Because we
Yeah.
can help you." I get that here as well, right? Somebody
Mhm.
might call, "I'm just hurting today. I don't think that I'm gonna come in." Well,
Mhm.
my go-to is just like, you know what, come see us. We're gonna help you. We'll make you feel
Yeah.
better. Because stretching and exercise and moving is really what you need when you're hurting. A
Yeah.
lot of people, I think, just making an awareness about that is so important.
Yeah. Yeah, and I'm sure you see an array of clients too, the people that are a little bit more sore and uncomfortable versus the people that are like, hey, like I've got some muscle soreness. I just had a great workout or a long run or something like that, and they could really benefit from the assisted stretching as well.
Yes, absolutely. We see a little bit of everything. So
Mhm.
we have youth athletes
Yep.
who might be coming in because they have, the start of an injury and they
Mhm.
can kind of feel it coming on. We have different physical therapy recovery tools that we utilize in the
Mhm.
studio, whether it's A-stim, cupping, dry needling, right?
Yes,
So
yes.
really, I look at those as a tool to be able to kind of address the injury before it becomes an issue.
Sure.
So, we'll target those areas and we'll use those tools and then we'll do the stretching along with it. And so our athletes are coming in before they're actually, before they even have to be off the field because of what's
Mhm.
going on. We keep them in the game, we keep them going. So it's almost part of their wellness program.
Yes, I love that.
Um, we work in a lot of 55 plus communities. And so we have,
Yeah,
our older population that this
sure.
stretching is amazing for them. Not only is it mobility, but it's balance, right? So
Mhm.
being able to move and get through greater range of motion, then we're going to help
Mhm.
them to improve their balance. And then
Mhm.
they can get out and play some pickleball or
Yeah, yeah,
go
yeah.
on their walks, whatever it is that they want to be able to do.
Sure.
We see a lot of runners and triathletes, right? So they might not be as consistent, but they're definitely people that we see maybe before a marathon, after a marathon.
Mhm.
It's really part of their recovery and helping them to be able to put in the miles that they need to leading up
Mhm.
to and then after their races.
Yep.
Um, and then just your general population. So those that, sit at work.
Yes.
So many people sit all day
Yes.
long and sometimes like we're the one thing that they have in their day that gives them some mobility and
Heck
like those
yeah.
aches and pains in their shoulders and their back and everything. We help those to just stay at bay,
Yep.
and we're a wellness program for them.
Yeah. I think
Hmm.
that's awesome. I mean, I think you've nailed the populations that could really benefit from it, and there's a lot of people that can benefit from that assisted stretching, and especially in those older adults, or not even like really old, but they need that greater range of motion, and it gets increasingly difficult to do it on your own. But maybe they don't want to commit to like going to physical therapy and being there for so long, and they just want the stretching. And I see that so much too. So I think you're filling a really, really good space, and I would not trust anybody else, to have their hands on a patient like that or a client like that, other than somebody that's well trained like yourself. So, like, I hope that people could recognize the benefit and the difference too. And I would encourage people to try out the difference between yours or someone else's, and they would just see and feel the difference for sure. There's just a elevated care that you're providing, and I hope people could take advantage of that. So, one of the patient populations that I love to treat is people with lower back pain. So run
Okay.
me through like what you typically do if someone may have lower back discomfort and what that session would look like.
Okay, perfect. So for us, and I strongly believe that balance in the
Okay.
body
Okay. Yeah. Yep.
really important, right? So that I preach this with all of our members, all of our clients, is that what we're looking for is to create balance in the body. And so ideally, majority of what we do is a full body stretch, right? So just because you have back pain
Okay.
doesn't mean that the only muscles that might be tight or out of balance
Mhm.
is surrounding the back. Could it be in the calf? Could it be up in the shoulders, right? So a lot of times, like, where is that back pain really coming from? And I
Okay.
have noticed that, I think as a PT, sometimes I have gotten so focused on one area of the body. And,
Mhm.
I would just treat that area without realizing that, hey, the whole body contributes to that pain in that one area, right? So when we stretch, uh, granted that it's for the low back, of course we focus hamstrings,
Yep.
piriformis, all of that, right?
Mhm.
We will do a full body stretch no matter what. Maybe for low back pain, I might focus more on somebody if they have tight hip flexors, because a lot of times people don't
100%.
realize, they're like, "I have been stretching my hamstrings
Yeah.
nonstop every day." I'm like, "Well, what about your hip flexors?" And I'll realize that, man, most of these people are so tight in the hip flexor, specifically,
Mhm.
psoas muscle. And when we get in and we do some stretching through the hips,
Yeah.
it makes a huge difference
Yeah.
for the back,
Yeah, I couldn't agree more. I mean, we live in
right?
a society that sits a lot, and people with that lower back stickiness or achiness, and they come in, and then you're like, "Hey, I'm going to tackle those hip flexors." It could be a great feeling, but it's a little bit of work to get those things to loosen up. And I can appreciate you doing that because it's well needed.
It is. And as a physical therapist, when you can get people into different positions with stretching that they really can't do themselves for the hip
Mhm,
flexors. It's very hard.
mhm,
Especially getting, higher into the hip and psoas
mhm.
muscle. There's so
Yep.
many compensations when you're stretching by yourself. You can compensate
Sure.
so much that you may never even get to that muscle.
Yeah.
So that's something that we're able to do manually, right?
Yeah.
We can get there.
Yeah, and that reminds me of the session that I had with you and like just laying on the table and then you going through the ranges of motion, but then not only what your hands are feeling, but what you're telling me, like, hey, like relax here or twist here or do that. And that helps us as a physical therapist to like align the body in a better way to tackle the areas that we want to hit. And so while it may just seem like a traditional hamstring stretch, we're doing other nuances and other little things that help take it to that next level and help you feel that difference. And how do we get that long lasting effect? And so, what goes on behind the scenes and in our brains and our hands while we're doing this, there's a lot to it that I know other people in the area are not able to do. And I
Right.
know that they're not having those thoughts and having that patient centered experience. And so I wish people more knew about it. Around the area because I know that they could benefit from it. So, what is, playing on to that though, what is something that you wish people knew about assisted stretching that you find yourself repeating a lot? Like people are like, oh, I didn't know XYZ.
I think probably the biggest thing with assisted stretching that's a misconception is the idea that stretching is painful.
Okay.
And I repeat this a lot in our group stretch classes where
Okay.
I see people, really pushing themselves and they're moaning and they're going and they're like, "Oh my gosh, well, you know, it should be relaxing, right?
Yes,
If
sir.
you're feeling
Sure.
any sort of pain, then you're going too far and you're not doing what you're supposed to be doing."
Sure.
So I think I want people to understand that, creating that mobility in your body, it doesn't need to be painful. The idea is that stretching is relaxing. It
Mhm.
feels good, right? And it should be comfortable. And
Mhm.
if you're in that frame of mind and that state for your body, then you're going to get the most out of the stretch. And when you come to us, that is that's our objective. We are
Mhm.
really, we're making it comfortable. We're
Awesome.
talking throughout the stretch. We have the ability to feel the muscle,
Mhm.
where it's starting to become tight, where, the
Mhm.
mobility is. And we're going to work through that slowly and comfortably.
I love
So
that. Yeah.
it's
I
not
think
painful.
Yeah, I think the communication, the expectations, right? I mean, if we can get those things set in the beginning of like, hey, you want these changes, this is what we have to do to get there, but this is what you're going to feel like along the way. And so I think just answering those questions just reduces the fear around it. And so, how do people? Well, tell us a little bit about what the services that Viva Stretch offers. Like we're just talking about assisted stretching, but I know you do other things as well. And then tell us about your location, your space, and how people can get a hold of you.
Okay. So our main business is the assisted stretch.
Okay.
That's really, where we see most of our clients and, spend most of our day. But I will
Mhm.
say that something that has been really cool that we've been able to offer is stretch classes. So we do 40-minute group stretch class. We incorporate dynamic stretching, static stretching.
Love it.
We have different equipment that we use just to provide the ability to do some different trunk rotation and
Yeah.
hip mobility, right, and things like that. So very different than what you would do at home, right?
Yep.
We can provide that group stretch experience. And then the idea is that, there's one or two takeaways that you might really appreciate from it. And then that's something
Mhm.
that you start doing independently at home too.
Perfect.
We do offer Pilates, so we have a Pilates reformer. Stretching is so
Hey.
important, but strengthening is as well, right? So
Mhm.
just as we were doing this, I realized, you know what? We're gaining flexibility, but so many people also need this core strength,
Yeah.
and
Yeah.
Pilates really offers that. So
Yeah.
yeah, we do the reformer, and then we have mat Pilates classes too.
Cool.
And then all of the physical therapy recovery tools. All of our members have access to Normatec compression boots, the massage guns. We offer, as a service, we offer ASTIM, which is a instrument assisted soft tissue technique
Mhm.
for really good for, the beginning of a tendonitis, muscle
Mhm.
restrictions, any sort of spasms, inflammation, things like that. And then we do cupping. We have a red light cup, which is pretty cool. So it incorporates the red light therapy into
Oh,
the cupping.
cool. Yeah.
And then dry needling, of course,
Yeah.
is
Awesome.
something that, personally is what I do. Very specific to physical
Yes.
therapy, but
Yes.
it goes right along with everything else. So
Yeah, I think you're right. And I just love seeing, like hearing you talk about like a more holistic approach to someone's health and that you're not limited. You can kind of see the individual and see what they may benefit from. And I really like that. So where's your location at?
so we are located in Mandarin,
Mhm.
just on the north side of the Julington Creek Bridge. Our address is 12708 San Jose Boulevard. So
Okay.
we're by the Julington Creek Fish Camp, across the street from the Fresh Market. I feel like those are the two main
Yeah.
main places that I can bring up, and everybody knows where we are. We also see clients out of a spa off of 210, so County Road 210. It's called
Mhm.
Spa Me.
Mhm.
So we have the ability to access, clients from just a different area over there. And then we also see clients in Marabella, at the F45 Marabella. So we're there as well.
Perfect. And what's your website?
Our website is vivastretch.com.
Perfect.
You can access all of our information there. You can call us and text us at 904-584-5432.
Awesome.
And then we also have our Facebook, Instagram, TikTok, all the above, at Viva Stretch is our handle.
Oh, awesome. Awesome. I love that. I know you're doing awesome things and there isn't anybody, if thinking of it from a person's perspective, if they're just looking for improving flexibility or range of motion or mobility, but even if they have some aches and pains that they know benefit from stretching, I wouldn't trust anybody but you and your team. And because I know you're well trained and you have the patient in mind. And so I really appreciate what you're doing. It's a great service. Your clinic is beautiful. It's just a nice, friendly environment. So keep up the great work. I really appreciate you taking the time to chat.
Yeah, I'm really happy to, be able to offer this as something that's in the full circle, right? So there's a time and a place for
Mhm.
everything. I still strongly believe in PT.
Yeah,
You know,
yeah,
there's absolutely a need for physical therapy. There's a time and a place for chiropractic, and it's very cool that stretching is something that we can fit into the entire wellness program.
yeah.
So cool.
Yeah, I agree. I agree. And I would encourage people to try out your services. They're not going to regret it. Thank you again for taking the time to chat. And I look forward to talking again.
Well, thank you.
Yeah, you're very welcome.
Having
Enjoy
me
your
on,
day.
on your show.
Yeah, yeah, no problem. No problem. Anytime.
All right, cool. Bye, Michael.